somebody who deals with some tailbone pain, some SI joint pain, maybe even some tightness in the back of your pelvic floor, then I have 3 ways that you can help ease the pain right now. Okay? Ultimately, we need to find out what's causing the tightness, where the weaknesses lie, where the imbalances lie, and address those. But these 3 exercises can really help start that process along, relieve some pain in the meantime, and help you feel really good through the backside of the hips. All right, so the first thing you're going to need is a trigger point ball, a tennis ball, a yoga ball, a lacrosse ball. Actually, a yoga ball works too, okay? But I have a trigger point ball. What I'm going to do is I'm going to sit on it. I'm going to place it between my sit bones and the midline of my body. So I'm really getting into that fleshy spot. You might have to kind of pull your buns out of the way a little bit. Really getting into that fleshy spot just inside my sit bones. And then from here, you're just breathing and relaxing and trying to melt into that ball and get that pelvic floor to relax. Make sure you do both sides and move it around a little bit. Try different spots. See where the tightness lies. One side might feel better than the other, and that's totally normal. Work on that tighter side. Really just trying to relax into it and let go. Then, once you've opened up and relaxed some of those muscles, we can come into a rock back. Okay, so you're going to be on your hands and knees. You're going to want to find that neutral spine and pelvis. Okay, so you're not rounding, you're not letting that belly fall. Nice and neutral. Shoulders are over wrists, hips are over knees. And then from here, you're just going to kind of push back slightly and slowly, allowing your sit bones to open and spread. Okay, coming back as far as you can before any rounding or tucking happens at the tailbone. And just coming back and forth. As soon as it feels tight or difficult, that's where you want to hold it. Take a nice big inhale, filling the back of that pelvis down into the pelvic floor. Exhale, come forward. Okay. Nice little rock back, doing maybe 10 or 12 of those, really practicing keeping that good form. Bonus, this really helps get you set and ready for better hinges, which are always helpful for opening the back of the body. And then our third exercise, you're going to take a yoga block and you're going to place one knee on the yoga block. So we're still in this hands and knees position, shoulders over wrists, hips over knees. The knee that is free is going to stay parallel to the knee on the yoga block. And I'm just going to drop it towards the floor, letting the hip follow. Okay. And holding here, you can open legs, you can bring them together, see what feels good. You can even start into that rock back as well. Okay. Again, thinking about your inhales, filling that pelvis, relaxing down into that pelvic floor. Just so you can see what it looks like from behind. Okay, I'm truly just letting this knee come towards the floor. I'm not shifting my whole body down. Okay, my weight stays nice and even over my hands as I let that knee come down and that hip follows. Again, you can open, you can cross, you can keep them straight, come into that rock back, sit bones opening. But breathing here, think exhale, lift the pelvic floor, tighten that deep core. Inhale, filling all the way down into that pelvic floor and pelvis, feeling the pelvic floor come down and relax. Okay, so if you are experiencing some of those common tightnesses through the back of the body, give these 3 exercises a shot, see how they feel, and let's get some of that freed up and feeling good.